This podcast is for educational purposes. Our guests aren't scripted and are free to speak their minds. Therefore, their views and opinions don't necessarily reflect those of BridgeBio Pharma. Also, your doctor is your best source of information about any symptoms you might be experiencing. Please consult a medical care professional about any health questions and concerns. Now, we hope you enjoy the podcast.
Welcome to On Rare, a rare disease podcast produced by BridgeBio, a biotech company that focuses on developing treatments for rare diseases. I'm your host, Mandy Rohrig, a member of the patient advocacy team, and I'm joined by my friend and colleague, David Rintel, head of patient advocacy. Hi, David.
Hi, Mandy.
David and I are excited to share this very special episode of On Rare on location in Sparta, North Carolina, where we met with Arielle and her family. Arielle and her son, Sebastian, live with a condition called ADH1, or autosomal dominant hypocalcemia type 1.
Mandy, I have to say that it's great to be on location and to get to know Arielle and her family, where they live, see their home, the playground where they take their kids, and you get a much better sense of what life is like for the people with whom we're talking on Rare. But let's first hear from our colleague, Scott Adler. He's the Chief Medical Officer of the BridgeBio affiliate Calcilytics, and he's also a nephrologist. We're so glad to have you, Scott.
Thank you, David. It's a pleasure to be with you today.
Scott, can you explain to us what is ADH1?
I'd be happy to. So ADH1 stands for autosomal dominant hypocalcemia type 1, and it is a rare inherited form of a disorder of the parathyroid glands. And the parathyroid glands are small glands that are located in the neck behind the thyroid gland. And so there are 4 small parathyroids. And hypoparathyroidism is a condition in which the parathyroid glands do not function properly and do not make enough parathyroid hormone, which is really important in regulating calcium in the blood.
How does it affect an individual living with non-functioning parathyroid glands?
When patients don't have enough parathyroid hormone, they are unable to maintain a normal calcium concentration. And so their blood calcium is very low and they wind up having symptoms. Some of those symptoms primarily include contractions of muscles when they don't want to have contraction of muscles. And the most severe form of that is called tetany, where people's muscles totally contract and they can't move. And it is quite painful.
So the parathyroid glands serve as almost a thermostat for regulating the amount of calcium in the blood.
That is correct. There's a defect in the thermostat allowing appropriate regulation of the blood calcium concentration. And so this receptor is called a calcium sensing receptor. It's a protein that sits on the surface of cells within the parathyroid gland. And when the calcium concentration falls, the parathyroid gland makes parathyroid hormone. In essence, it's like having your thermostat in your house. When the temperature is 50 degrees, it should kick on the furnace to create heat, but it doesn't do that. It says 50 degrees is perfectly fine, and it does not turn on the heat.
For people living with ADH1 today, what kind of treatment is the current standard to help manage hypoparathyroidism?
Today, when patients are diagnosed with ADH1, they are prescribed oral calcium tablets as well as oral active vitamin D, and they need to take these medicines 2 or 3 or 4 times a day in order to help the body maintain a blood calcium concentration that prevents them from having symptoms of hypocalcemia.
And how well does that work?
It can work well to prevent them from having symptoms, but it's very difficult taking calcium 3-4 times a day in order to maintain the right concentration in the blood. And sometimes they overshoot and their calcium comes out of their blood into their urine. And so they have excess calcium in the urine. And that can cause calcifications in the kidney and sometimes develop kidney stones. Sometimes in worst case scenarios, they can wind up developing chronic kidney disease and in rare circumstances, developing kidney failure.
So a very challenging condition to currently treat effectively.
That is correct.
All right, Scott, this is a genetic condition, and autosomal dominant means that if you have one parent who has ADH1, you have a 50% likelihood of developing it yourself?
Correct.
How did the genetics work in ADH1, and what is it like among family members?
So each of us carries 2 copies of each gene. And if you have a mutation in one of those genes and you happen to pass that gene along to your offspring, the autosomal dominant means that that person, if they inherit that mutated gene, they will have the condition.
So it's likely when you find someone who's living with ADH1 that they're going to have other family members. They may or may not know that they have the condition.
Correct.
And is it usually evident in childhood? Does sometimes symptoms develop later than childhood? How does that work?
When you are a carrier of an autosomal dominant gene, you typically have the clinical manifestations of that disease, and you have a 50% chance of passing it on to your offspring. Many people who inherit the gene will have symptoms, many of whom have symptoms at birth. And so within minutes after birth, it is recognized that they have symptoms of muscle spasms and are tested, and they're shown to have low calcium. And then it is pretty easy to make the diagnosis, particularly if a parent has the same condition. Again, there are milder forms of the disease, and so maybe they're not recognized at birth, but sometime during childhood, if the child gets sick in some way and their blood calcium levels fall, they can certainly develop symptoms, and then it would be diagnosed in that way.
Scott, thank you so much. That was such a clear explanation. We're very grateful, and it's going to really help us as we talk to Arielle about her experience.
It's my pleasure. Thank you, David.
So nice to be here and to be together with Arielle.
Arielle, welcome.
Yes, I'm so excited to be here today.
So we want to start at the beginning of your story. Tell us a little bit about yourself.
I was born and raised in Florida. My childhood was pretty normal, always getting up to hijinks with my brother, doing lots of outdoor adventures. I was always really healthy, aside from the fact that I was the only kid I knew who was allowed to eat ice cream for breakfast every single day. From the time I can remember, I was younger than my son Sebastian, all the way up through high school. Every morning for breakfast, I was allowed to eat ice cream.
I bet your friends were jealous.
They were jealous. Every time I asked about it, my mother would always just make a comment of, your calcium's low. You're allowed to eat ice cream. Didn't think much of it beyond that. I enjoyed it immensely. I was even allowed sometimes to eat frozen cheesecake for breakfast in the mornings, as long as it was something with dairy, something with calcium, and never made me bat an eye. It wasn't really until I got to high school that I really started learning a bit more about the calcium, and that it wasn't quite normal to be eating ice cream every day to keep calcium levels normal. So that was a bit of a shift as I was learning more about the science behind it. And that led up to when I actually had my diagnosis.
So how old were you when you were diagnosed?
I was diagnosed when I was 16. It was about 3 months after I had an injection for some medicine or other, and it had dropped my calcium levels. And my body then realized, hey, we can't really account for that.
So what did you experience when you had that first incident of low calcium that you recalled around 16?
So it caused a big change in my mood when I was in high school. Already moody. Nothing's really going to change that. But it went a bit beyond that. I started hallucinating a little bit to where I was hearing voices. It was like a type of seizure, I was told later. And then my heart rate started going up. I started kind of getting really shaky and twitchy. And my primary care doctor at the time had then referred me to an endocrinologist to start getting treatment for what became hypoparathyroidism.
So how did that doctor explain it to you?
Essentially just that my calcium had gotten so low in my body that my brain couldn't really catch up to it. and it couldn't properly release the hormone or the little chemical that would tell my body to absorb the calcium like it was supposed to. So all the calcium I was getting in with my food, none of that was actually sticking. So I was needing certain special medicine to be able to make sure that my body was absorbing the calcium like it was supposed to. So that was really how they described it.
So the parathyroid hormone helps to regulate calcium levels in your blood.
Yes, through acting with the vitamin D, like the stuff you get from the sun. And it's just with this particular disorder, I guess the vitamin D you just get over the counter wasn't able to work with the body because the parathyroid just decided to quit working, close up shop. So all of the calcium was going out of the body from the kidneys and everything instead of staying where it was supposed to be in the blood.
So your parents had an awareness that you had chronic low calcium, but there was no diagnosis at the time of the cause of the low calcium?
No, my diagnosis when I was a teenager was the first time. As I was getting older, I never had blood work or anything that was done. I know when I was a baby, I had febrile seizures, very similar to my son, Sebastian. Except for they were never diagnosed, but they were visible, they were recorded by my mother, and she just knew.
So at 16, you got the diagnosis. You were provided some type of management, which sounds like vitamins and supplements. Can you tell us a little bit about how you managed your ADH1?
Oh my goodness. It was a rocky roller coaster. I will say my first doctor did not have a particularly good bedside manner. When you're a 16-year-old, you've never had to take medicine a day of your life, and then all of a sudden you're told you have to take medicine for the rest of your life. That can be very overwhelming. And then add that, the fact that if I told him I missed a day, he then told me I was going to go blind.
Oh, wow.
Because I was not taking my medicine as I was supposed to. So that was a little bit of a disappointment, I guess. Now, as a medical professional looking back, I get what he was trying to do. There's just a way to be able to go about it. But I went and I took my medicine most every day, give or take the few days of rebellion. I adjusted my diet to eat more calcium foods, cut back on foods that were high in phosphorus, because I learned that certain foods I'd really liked were high in phosphorus, which could cut the ability of the calcium to get absorbed from that food. So they were like, complete diet change, never look back, take all these medications, and even going so far as to tell a 16-year-old, hey, you may never be able to have kids. He really needed to work on that bedside manner.
So he told you you may not be able to have kids. He also told you that you would go blind. The medication that you were taking then, starting around 16, was vitamin D and
calcium. So it was a form of vitamin D called calcitrol. It's really commonly used for people in kidney failure. Always weird questions at the pharmacy when you're like, no, I don't have kidney failure, I have hypoparathyroidism. They're like, what's that?
Were you told that it was the genetic form of hypoparathyroidism, or was that not known at the time?
When I received my diagnosis of hypoparathyroidism, it was right around the same time my father was diagnosed post-deployment. They did not ever do the testing formally for it being genetic or anything along those lines. They just looked at me, they looked at my dad, they checked a box and said, well, we know where it came from.
So it was like an informal diagnosis that it was genetic.
Yeah.
So once you started on using some of the medicines that they suggested, did it help you feel better?
So as soon as I started the medication, started the treatment, it was night and day. I thankfully stopped having whatever weird seizure episodes I was having. The tremors completely stopped. The heart rate went back to normal. As long as I was on the medicine, everything was just as it had been, with the change of I had to take medicine a couple times a day, and I did not like swallowing pills at that time, so that was a chore.
This is usually the psychologist's question, but how did it make you feel?
Suddenly you had
Thank you for asking that, Mandy.
Because that's a big shift in your life, right?
It was. I just kept that part at home. I never really talked about it at school, never really kept up much with telling my friends about it. I just adapted, and I was 16, so even the thought of not having kids, I was like, well, I'm 16. I don't want kids right now. So overall, it wasn't really that jarring overall, outside of the annoyance of taking the medicine and having a doctor always saying that my medical conditions would plummet across the board.
There's a lot of discussion about how to help people who need to take medication with adherence, because most people who are prescribed medication either don't fill the prescription, or they fill it, they don't take it, or if they take it, they don't take it as directed. So it sounds like this healthcare provider was in the scare them to death school of increasing adherence.
Yes, and as I learned later with nursing, there's different ways to promote medication adherence that are less traumatizing to young kids, positive reinforcement instead. So there's a lot of things along those lines that could be learned from this.
So going from not taking medication to taking medication every day is a big change though, right?
Yes, it didn't disrupt everything though. It wasn't the end of the world, as most teenagers would like it to be. It was just something I saw that my dad was having to do it. I was feeling much better when I was taking the medication. And I had several years, even going up through college, to where my doctor said I didn't have to take medicine because my levels would be that good.
So you got diagnosed in high school, ventured into college, decided to pursue nursing.
Yeah, well, dealing with the health condition I had, and then also with all the health conditions my father had, really cemented the idea of going into nursing. I was really nerdy in school, so I loved all of it. Having this disorder with the calcium really helped to give me that good motivation for why I was wanting to pursue it and excel. For a little while, I thought maybe I didn't need medication anymore at all. And then I decided to stop. And 2 days later, it was the exact same symptoms I had when I was 16. Hearing voices again, and my now husband, we had just started dating, was tapping me on the shoulder 30 minutes later because I had completely spaced out and lost track of reality for like half an hour and had to get rushed to the emergency room. My calcium was down, they said organ failure zone, from not taking my medicine for, I think it was 2 days. They gave me IV calcium. They gave me some head scans and confirmed I was mentally sound, might I add. And then they proceeded to then cut me loose, and it really kind of hit that point home. Medication compliance is very important.
But you were kind of encouraged to go off because sometimes your doctor would say
Yes.
you don't need to take it because you were so well controlled. But that perhaps was over.
Yeah, it was
zealous
very overzealous of me. I was thinking I had it made. I had like cured myself, like I had grown out of it. This disorder is not necessarily something you grow out of. It's something that you grow with and you adapt with.
But your boyfriend at the time, now husband, this was like a test for him, right?
He did pass with flying colors in that regard. I think that must have been why I kept him.
So tell us a little bit about you and your husband, James.
Yeah, we met in college. We actually grew up 5 minutes away from each other our whole lives, but we did not go to the same schools until we got to college. So we didn't actually meet until an honors class. It was a year after we had met that we had started dating, and he immediately was okay when I was talking to him about the health disorder that I have, and he wanted to understand more of it, but he wanted only the really high level stuff because he's an accountant. Like, accountants don't necessarily want to know the pathophysiology of how calcium affects your body. He just wants to know, when this happens, what should I do? So it was just something that we worked through it. We married right after college, and then within a couple years after that, we were able to have our first kid. I had been told, you might never have kids. And so that had been something going in that I had let him know that I'd been told this growing up. But none of the doctors that we were working with when we moved to North Carolina from Florida knew what a hypoparathyroidism even was. So they didn't know what to be looking for with my son. They just knew, oh, you're our only patient we have with this disorder. Let's just kind of trial it out and we'll test some stuff. We'll see what might work for you. So that was interesting. Being pregnant, actually both times, was that nobody knows how to manage it.
So when you and James started dating, you shared about your condition quite early in your relationship then.
Oh, yeah. It was right when we were starting to date. He asked pretty early on why I was taking these orange and white pills. So I shared that with him and was just talking to him all about how it affects my day-to-day life.
And did you share also that your father also had it?
Yes, he met my parents pretty early on.
It's a good sign.
Yes, it was a good sign. He was originally supposed to be, the rebound guy, and somehow within a few weeks he was meeting my parents, and
maybe not the rebound guy.
I know. The rest was kind of history there, but what can you do? About a month in, we had the baby names picked out. So it was a pretty done deal pretty early on, and let me just say Sebastian was actually the top name.
If James had not reacted positively, like had said, oh, gee, I don't know if I could take on a problem like this or whatever, probably get the big boot out the door.
Most likely, yeah. There probably would have been a boot.
So good thing he played his cards well.
Yes.
We've met him, and he seems the kind of person who is ready to take on what needs to be taken on.
Yes, he has been through several hospital stays and ER admissions that I've had to go through. Really been a big support for that.
I'm just reminded of someone else we interviewed for the podcast named Karis. We met with her boyfriend. I think most good people really are not scared off by a long-term medical condition. And a lot of people who live with long-term medical conditions are really concerned that they won't be able to find a partner because, we live in a society that seems to value physical perfection too much, and long-term illness does not fall into the category of physical perfections. And look at the family that you've built and the life that you've built together.
Oh, yeah. No, I wouldn't trade it for the world. And now it's just about continuing on with just managing things and making it better for my son.
You mentioned that James has lived through a number of health crises with you. So I wonder if you don't mind letting us know, because like a lot of other medical conditions does not show on the outside. You look marvelous, as they say. But it would be helpful to know what kind of health crises you've had due to ADH1.
So I had already mentioned where I had the extremely high heart rate. I've also had several points to where I lost complete feeling in my arms and my legs because my calcium had gotten that low that the kind of the numbness and the tingling just went completely up to where I was feeling like I was wearing like really thick wool stockings on my hands and my feet. So that was a stay. After I had my kids, after Sebastian, I actually went into acute kidney failure as a result of my calcium dose hadn't actually been adjusted after I had him, because you need much higher doses of calcium when you're pregnant and growing a little baby. Afterwards, not as much. So that was a 3 to 4 day hospital stay with a 1-month-old.
So just to be clear, they were still very high after you delivered?
Yes, my calcium level had gotten up to, I think, above 16. It's normally supposed to be around like 8 to 10. So that one required a lot of IV fluids, and then my calcium got too low. After I had my daughter, I actually got kidney stones that were calcium. So I had to get surgery when Ellie was just a few months old to get that removed. No more kidney stones since that, but it was something they said that was related to me being pregnant, that my body's response was causing damage to my kidneys. So those are some of the examples that I'm remembering with hospitalizations. There was other here or there to where I noticed, half my face was starting to go numb, and I went to get checked out to make sure I wasn't having a stroke, and it was the calcium. And so all roads tended to lead back to the low calcium when I would have to get admitted.
So you really needed to rely on James, not just to help care for you, but to also to help care for the kids while this was going on.
Yes, because especially stomach bugs and things like that, if those ever come up, especially just that dehydration aspect, like it literally incapacitates you to have a low calcium disorder and then to have an acute virus that drops your calcium so quickly because you essentially get to where you can't move your arms and legs well. Like I got like severe like contractures and I couldn't like move my hands out of a claw. Like it was like insanely painful. And so a lot of those things just in the moment especially are really scary because I'm really healthy all the time except for When I'm not, then I'm living in the emergency room for several hours to days.
And that phenomenon where your hands like go into a clot, that is called tetany.
Yes. It's one of those fun signs of the low calcium.
Yeah. When your calcium levels are too high or too low, it really has a profound effect on your health and your functioning.
Yes. If it gets too high, my husband says you can always tell, because he's like, it's the only time in your life I can ever say you're not being smart.
You get really cloudy?
Yes, I get such a bad brain fog. And then he'll be asking me a really simple question, and it takes me like 3 to 4 minutes to respond. So that's normally his check-in, is he'll be like, we might need to get your blood work checked.
You have 2 children, Sebastian and Eleanor, and Sebastian is your eldest. Tell us a little bit about how you were monitored during his pregnancy and how your hypoparathyroidism impacted his care.
So when I was pregnant with my hypoparathyroidism, I had immediately let my endocrinologist know. Pregnant, I told my husband, of course, first. Then right afterwards, I messaged my endocrinologist. She immediately started doing much more frequent lab work, and we were noticing when I was needing a bit more calcium, depending on where we were pregnancy week-wise. And so that was all going really well. It wasn't until, I guess, 2 weeks before I was set to have Sebastian that they checked and found out he was being stubborn and got his head stuck in my ribs and was going to be breech. So all of a sudden, what was supposed to be a normal pregnancy then escalated to, you got to have an emergency C-section. So they had to do all these extra protocols with getting the endocrinologist, trying to get one for in the hospital. And that was actually where that lapse in care occurred, was that they never actually had notified her when I was in the hospital, even though I'd asked for it. And so she was not able to adjust the protocol. And the hospital doctor instead said, oh, you're on stuff, you're fine. So the delivery itself with the C-section went as expected. He wasn't breathing at first. Most terrifying, 5 seconds of my life until they got him going. And he yelled out, and then he was right there with me, settled down, and everything was great. And then I was able to get discharged. Everything was going great. And it wasn't until, again, a couple weeks later, I'm still waiting for word from the doctor on how to adjust my medicine. And then nothing's happening. And then, I'm sleep deprived. I'm slowly, as my husband put it, thinking less and less. Then it finally just escalated again to where I got so dehydrated, I was struggling to kind of move around. And then they brought me to the hospital on the unit where I worked as a floor nurse, mind you. I got admitted with kidney failure and had to stay for several days with IV fluids, with my husband bringing my newborn up to a dirty hospital. I was nursing him and everything. At the time, it was just isolated to me. We didn't even know that Sebastian had anything wrong with his calcium for a couple of years after that, so.
Oh, so there was no testing of Sebastian?
No. I had kept bringing up that I had it the entire time I was pregnant to his pediatrician, his pediatrician was wonderful. We loved him. We were just told whenever he starts showing symptoms, we will start running all the testing immediately. But at the time, he didn't show any symptoms. He ate well. He was growing great. And so there was not really any signs that he had any health issues until he turned 1 and started having seizures.
Can you tell us more about that?
Yeah, tell us about that.
When Sebastian was 1, he started with having febrile seizures. His first one was in a bathtub, and he went completely unresponsive. And so while James was rushing to go call an ambulance, I actually had to resuscitate him. We brought him to the hospital, and we were told it's a one-off. He had just had a reaction, they were saying, to the shot, it made his fever go up. They were like, yeah, he won't have it again. So we're like, okay. So we take him home. He's seeming great. Next time he gets an illness, he has another seizure. And then we bring him back in. They're like, oh, it's just the second time. This isn't going to happen again. And then by the 3rd or 4th time, all of a sudden we're like, you need to listen to us. Something is wrong. By that point, I think he was 2 or 3, and that's where we finally got linked up with a neurologist, and they started thinking that he was definitely having a pattern of febrile seizures. And they didn't even start medicating him for seizures until about 2 years ago.
Between the age of 1 to say 2 or 3, kids get sick often, right?
Yes.
And every time he had a fever, he had a seizure?
Yes. So we were constantly on guard. We could have bought stock in fever-reducing medicine with how much we kept in the house. And we were around the clock for like 2 to 3 days. Anytime he got sick, we were like staying awake all through the night. We were watching him because a few of the seizures he had were actually when he was in bed asleep. One of them, he had actually gone face down in his crib and vomited. So he started to aspirate, and we thankfully heard some noises. And so we were just always very hyper vigilant. It was right during COVID when all this was going on, so that didn't help matters much. So it was just a constant fear, just a lot to deal with, but they didn't know why he was having all these seizures. They just kept monitoring, kept saying, okay, we'll keep an eye. Then he had a seizure that lasted almost 5 minutes. And now his seizures when he was younger, when he had his febrile seizures, they were posturing, they were eyes rolling back in the head, they were tonic-clonic, like jerking, like stiffening of the extremities, like foaming at the mouth, vomiting, like they were not pretty seizures. When he had one that was almost lasting 5 minutes, and we were just horrified. And so I had to like get my husband to like jump into the car, and I was like holding his head in my lap in the back seat because we couldn't even buckle him into the car because he kept like just throwing up. And that was when his neurologist really started him on medicine, seizure medicine, and was like, oh, we're going to say he has some sort of like epilepsy. And after that medicine, everything went away for a year. We were starting to get relieved. We're like, oh, he's going to grow out of this, because they told us 6. Because they stop after 6 when the brain gets developed enough. So we go a year, we're feeling great. We're like, oh my gosh, it's going to be like another year and then he can get off medicine. Then he started having more seizures, and these looked different.
So he was on seizure medicine. It was helping.
Yes. And then it seemed like it stopped working completely right whenever he started hitting some growth spurts. He started having seizures again, and it was just staring spells. We kept questioning him. We're like, it doesn't look like before. And they were occurring randomly. We kept telling his neurologist. We cycled through several. I think we're on neurologist 6 now, honestly. Why is this not working? Because they kept upping his seizure medicine like every 2 to 3 weeks for like a period of 3 or 4 months. And he kept having the episodes. We were like describing them to the neurologist. She even saw them. And that was also around the time when, you know, they were thinking he was dying. So it was just like, we're just like, what is going on?
Yeah, just please find some answers for your child. But at no point along this way, someone had asked you about your medical history and your father's medical history?
They knew about the hypoparathyroidism, and they never connected it to that. I was like, well, I have low calcium, and my son, on this blood work you've been doing, it's showing low calcium. And they're like, oh no, it's not related to that. And they kind of dismissed it. And they're like, no, it's epilepsy. See, he's got something on his scan that shows it. But he kept having the seizures and like these little staring spells to where he was like looking, he'd be playing soccer, and all of a sudden he would freeze. And 20 to 30 seconds later, he would start moving in the direction he had seen the ball. It was just weird. And we would just feel like, oh, buddy. And his like stomach would hurt, his head would hurt after, and he was miserable. And then they finally hospitalized him in October because we're like, he keeps having this. They're like, we don't want to up the medicine more. And I was like, I don't want you to. I want you to figure out what's wrong with my son. And they're like, well, we can't find anything. And they're like, his calcium's low, but it looks like it's been low for the entire past year or so. And I was like, well, that's kind of when he started having these things. And they're like, I'm going to call in a guy. It's like, it's an unofficial referral. They're like, but he's the calcium guy.
The calcium guy.
Yes, he's amazing. But he just like walked in and he took one look at Sebastian's blood work and immediately assigned himself to my son's case. He came in with his assistant to the children's hospital, and then he's like, your son has hypoparathyroidism like you. And he's like, I was looking over the file to where you told the doctor that you had this. He's like, and I think I know exactly what type it is too. He's like, I think you have ADH1. He's like, have you ever been tested for this? And I was like, no. They're like, well, I want to get the geneticist consult in. He's like, we're going to find out for sure it's that, because then we'll have a specific treatment protocol. And I just like looked at him. I was like, yes. I was like 100 times yes. For years, I've been telling people, I was like, well, I have a calcium disorder. Do you think any of this is related? And they were always like, no. And then for this guy, a doctor to come in and be all like, I've got the answer. We were like, oh. So it was wonderful. And so they tested him. They found out he had ADH1. They tested me as well, I guess to also confirm I was his mother. I'm not sure why, but they also confirmed that I indeed also had it.
I think I recall you having a C-section, so...
It would be an elaborate hoax.
Elaborate.
Who his father was could still be a mystery, but...
Oh no, they confirmed that too, so...
You have 4 dogs and 4 cats. You need to have a lot of love in your house to be able to live with 8 animals and 3 other humans. One of the animals is pretty special to Sebastian, I hear, and I wonder if you could tell us about that.
Yes, and regarding all the animals in my house, I will say I'm not sure if it's so much love as just a desire to have unending chaos in my house and never having any clean floors. But outside of that, my son's cat, Finnegan, is a very special cat. See, we found him growing underneath a squash plant where he was abandoned in our garden 2 years ago. And this was timed out right when Sebastian was having his rapid uptick in the pseudo-seizure activity that they later attributed to his calcium. We did not want another animal, let me just tell you that. We were 6 strong at that point. We had just taken in a corgi. We were like, no. But the moment they laid eyes on each other, that kitten immediately gravitated towards Sebastian. Like, I have pictures of them together, like within knowing each other for 20 minutes. He was like reading a book and this little kitten was like in my office, like curled up against him, just staying with him. They just have such a wonderful bond, because anytime he started having a seizure or anytime he started just not feeling well, even before this kind of the staring spell started, Finn was immediately just leaping into action. He was like going straight to Sebastian and cuddling up like right near him. If it was happening during the night, we would know that Sebastian had a bad night, because we would see Finn get up from wherever he was in the house, and he goes and he rests right up against the side of Sebastian's head on his pillow. Because otherwise, if Sebastian's doing well, Finn will like go and sit vigil on another part of the bed or in the room. But we know anytime Sebastian's feeling sick, like Finn is right there. And he's even alerted us a few times and meowed at the baby monitor when Sebastian was having one of his seizures that made him vomit in bed. We would hear the cat yowling in the middle of the night, and we're like, wait, what? And then we would like look up at the monitor and we would hear like that weird sound that was Sebastian, like in the middle of one of his episodes. And we would just like immediately be able to rush up and take care of him. But Finnegan just always seems to know. We could not separate the two of them. Like, Sebastian was devastated if ever they were apart. The cat went through withdrawals when we were in the hospital for several days because he didn't know where to sleep. He was just wandering around the house crying for Sebastian. It was really good to see, and it was a really perfect time. And then, this year we, of course, had to get him a kitten from the kitten lottery system in town. And so now Finn has an emotional support cat named Knox. So, they still get up to crazy mischief. But anytime Sebastian is even remotely starting to feel under the weather, and we've even seen him do it some with Ellie too, when she gets sick, like Finn is right there. Like, he just innately just knows immediately that one of the kids is starting to get sick, and he just leaps to action.
Wonderful story.
Sounds like the cat needs a cape too.
Yeah.
We tried to put a cape and dragon wings on him previously.
So what are some of the symptoms that Sebastian has?
And do they think that the seizures were all along because of his ADH1?
It's a toss-up. The type of epilepsy he has is focal epilepsy. Now that they've kind of formally gotten that down, he has like the vomiting, he gets the migraines, he gets kind of the stomach ache and the staring spells. So that's kind of what happens with part of his brain. The seizures that they're attributing to the calcium, that was looking more like a different type of seizure called absent seizures, where it's just the staring spells and potentially like migraines. And so they were thinking that that was the cause of the rapid uptick in all the seizures, was he hit a growth spurt, his body could not compensate. So unlike, myself and my dad, where ours were triggered by getting a certain medication that like caused our calciums to plummet, like his was just growing. As soon as he got started by, the doctor in the cape at the children's hospital, It was within 2 days. All of a sudden, he went from feeling miserable. He wasn't wanting to play on the playground. Like he went from feeling really sad, not wanting to be around his friends anymore, to he all of a sudden like woke up. He's like, I feel great. And all of a sudden, like just taking the calcium, like no symptoms whatsoever. And he was all of a sudden like doing amazing. And we're like, wow, like he still has some sort of underlying seizure disorder, but we're like, wow, there's still a potential for him to outgrow that and then just be managed well with the medications.
And we've met Sebastian, and he is a curious, articulate, energetic, thoughtful, fun little guy.
He is, yes. When he's starting to feel his calcium dropping again, he knows. He says he feels like he goes to that bad place again, to where his head, he's unfocused, and things start to hurt. And so he's really able to tell us when he's noticing that so we can get the blood work. So
what are you hoping for the future? What do you see for the future for your family and for Sebastian, and how this condition might be managed when you look ahead?
Honestly, I've seen it from so many different angles, just thinking about these new future treatment options that are starting to come out. And wow, there might be one pill that could make a difference in constantly having to navigate the highs and the lows, and taking 2 to 4 medicines to just one. That would just be such a huge game changer of being able to, again, have more of that normalcy, have that less lows, less highs, be Goldilocks right in the middle. I think that would be a big thing. And it would also prevent Sebastian from having some of the chronic things that have come on for my dad, with his pseudo Parkinson's, from the calcifications to the kidney disease, and really make it to where, again, he could be an adult and just have one pill and be able to say, yeah, everything's great.
That sounds like it would really change life for the better. Although, you're clearly doing well, but it is a difficult condition to manage.
Yeah, it's less so for me and more so for Sebastian, because I wasn't diagnosed until I was 16. Heck, I lived off ice cream for most of my childhood. As I found out at 16, it's not fun taking medicine when you're a kid. You got to do it, but it's not that fun.
And ice cream can just be fun.
Ice cream was wonderful.
I was thinking of putting myself on an ice cream regimen. It did very well for you.
Now being a nurse, I will say it is probably not the best life decision, especially if you have, any pre-existing conditions, any diabetes.
You're probably right. And you are a nurse. And nurses are always right.
Well, I don't know about that, but we're pretty darn close. So,
So I'm curious what you think, Arielle. Do you imagine that there are more people who have hypoparathyroidism that don't know it?
That is a really interesting question, Mandy. And I think the answer is yes. I actually had this very question with my anatomy professor in college, because I mentioned I'm a nerd, and I was doing extra credit lab work and tutoring after hours, and we were discussing my calcium disorder, and he was bringing up how it was really interesting how I was diagnosed so late, and how had I never taken the medication that originally kind of triggered that response in my body, it's I might not have known about it for many years. My dad didn't know about it until he was late 20s, 30s. My uncle, when has some of the lab abnormalities, but otherwise he's never been diagnosed. And so it really does make me think it's one of those kind of really secret health conditions that maybe it needs to have more of that awareness of, hey, if there's a low calcium, why is it low? And really raise that question of maybe that should be looked into further, because if more people have it, it's much more likely to get more treatment options available.
Well, you sharing your story with us today is a step in that direction for more awareness. And we're really grateful for allowing us to join you.
Thank you so much. We've really, really enjoyed talking to you.
Thank you so much for having me. It was wonderful. Really makes the difference for kids like Sebastian.
While ice cream is a lovely option when you're a kid, it's clearly not a sustainable option for an ongoing treatment. I think Arielle made that very clear. But it was also great to hear how people with low calcium have managed until they're able to get a diagnosis. And for Arielle, it took many, many years. And for her father and for her uncle, it's taken even longer. So I think a big message is it's important to seek a diagnosis to get a better treatment plan in place.
Yes, Mandy, I just have been thinking about how people can be living with hypoparathyroidism, low calcium, ADH1, and it's known that they have low calcium in their blood, but there's no diagnosis being pursued and they don't know what their condition is. So we need to improve the diagnostic process for people who have low calcium, and the cause of that should be investigated.
Yeah. I think the other even bigger message that we can get from our conversation with Arielle is don't hesitate to ask why and to keep asking why, right? If Arielle wasn't persistent and she didn't continue to ask why and demand answers and seek a diagnosis for Sebastian, then he would continue to be on a different trajectory.
Just lovely, warm people. Everyone we met in Sparta, North Carolina was also very warm and really nice. It was a pleasure being there. And being there is so much richer and you get such a fuller sense of people's lives.
So people of Sparta who are listening, we'll be back.
Thank you for having us, Sparta.
Thanks, David. Thank you to Arielle and her family for hosting us in North Carolina and for sharing your story. Thank you to Dr. Adler for helping us understand ADH1. Thank you to our wonderful producer, Amy Brooks. To learn more about ADH1, check out Hypoparathyroid Association at hypopara.org. If you liked this podcast, please subscribe. And if you have any questions or comments, write us at onrare@bridgebio.com. Thanks for being with us today, and we look forward to you joining us for our next conversation on Rare.